At a time when India is witnessing a dip in its COVID-19 tally, Kerala is back in the focus, but for all the wrong reasons. The state is witnessing a steady increase in its COVID-19 infections. Now, this comes at a time when about 23 states and union territories across the country have fewer active cases as compared to what they had about 2 weeks ago. But not all is well with Kerala, the state that had claimed an early success in defeating the deadly coronavirus. Now, Kerala, ladies and gentlemen, is the same state that had reported the first COVID-19 infection in India. This particular state now has over 1 lakh COVID infections. Now, this is the same state that was hailed globally for its effective containment strategy and the model that they followed to defeat COVID-19. Even before India reported its first COVID-19 infection on 30th of January in Kerala, the state was all prepared to defeat it. There were isolation wards in every district, in every private hospital. A rapid response team, which was headed by the state health minister herself, was in place. There were state and district control rooms. Awareness drives were conducted so that there's no misinformation and fear among people about COVID-19. The police force was making use of drone surveillance to ensure people remain indoors and much more. So when India reported its first COVID infection on 30th of January, Kerala was all prepared and equipped. Now, in the month of April, Kerala claimed that it has successfully defeated the virus and flattened its coronavirus curve. Experts suggested that Kerala was successfully able to defeat the virus based on 2 factors. First, aggressive testing. Second, contact tracing. Now, in the month of April, talks in Kerala were that it would become the first state to implement an exit strategy for the lockdown. There were days in the month of May when Kerala reported no new COVID-19 infections. If there was anywhere the coronavirus curve was actually flattening, it was here. Then what exactly went wrong with Kerala and how did it become one of the worst hit states by the deadly COVID-19? Can we say that the state started celebrating its success very early? On 7th of October, ladies and gentlemen, Kerala achieved the milestone of recording 10,000 COVID infections in just one day. 8 out of the 10 districts which reported the worst spike in COVID-19 infections in the last week were in Kerala. The case load jumped over 20% in all 14 districts of the state. The testing in Kerala is also the highest, with over 8 lakh samples being tested in just few weeks. The numbers started moving in the wrong directions after a large number of migrants started returning to Kerala as businesses were affected in the Arab countries due to COVID-19. As per reports, some 5 lakh people are believed to have returned to Kerala till mid of July, many of them carrying the deadly coronavirus with them. Now, after the migrant influx surged in July, over 90% of the COVID-19 infections that were recorded in Kerala were imported from outside. Things changed in the same month when the share of local infections also surged. By the end of July, the tables completely turned as more than 90% of the new cases that were recorded in Kerala were local infections. Many experts have pointed out the laxity in maintaining social distancing in the state, especially during festivals like Onam that have contributed to the spike in COVID infections. After Onam, Kerala reported a 126% increase in its active COVID cases. Now, State Health Minister K.K. Shelja has said that if the virus spreads rapidly, the state will be facing a dual crisis because of the state's demography. The health minister said that the state has a high population density. The elderly population or the senior citizen population in Kerala constitutes about 14% of the total population, and the state also has a high rate of non-communicable lifestyle diseases. Now, speaking about the COVID situation in the state, the health minister said that there was a huge laxity from the public during Onam celebrations, which were in September, which resulted in surge of cases. The health minister said that there were large-scale protests by political parties, and the danger of protests is not that it leads to the spread of infections, but it also makes people believe that it is okay to gather in large numbers or to come out at such a time. The health minister also said that it led to a tendency among people to think that they can afford to risk their lives and come out. More than 200 police officers who tried to get the situation under control are also down with COVID. Kerala Health Minister said that the state did everything right during the first wave of the deadly pandemic. However, things went wrong when the state believed that the virus or the pandemic had completely disappeared when it had only retreated. The state health minister also said that even as Kerala hopes that tough measures may be sufficient in flattening the coronavirus curve in the state, the failure to implement them or follow them may make Kerala the worst COVID-19 hotspot in the country. On 1st of October, the Kerala government imposed Section 144 that bans the assembly of 5 people or more in the state till the end of this month. Such measures are likely to be in place until COVID cases completely retreat in the state of Kerala. The state government is also planning to strengthen the reverse quarantine for senior citizens under the Grand Care program. Telemedicines are also likely to be strengthened and borders will remain open. However, those coming from outside will report to the state and village level committees will be alerted on unauthorized entries. As the cases continue to spike in the state of Kerala, one silver lining is the death rate of 0.4% in the state, that is among the lowest in the country. The state of Kerala has been able to save more lives than the national or the global average. However, the state still needs to look into reducing the COVID active cases, as no state can afford to be complacent at such a time. The drawbacks of the Kerala model to defeat COVID-19 can definitely act as a lesson for northern states who need to be prepared, especially at a time when there are multiple festivals coming in the near future. According to a recent report released by the National Centre for Disease Control, the report clearly mentions that coming festivals right from Chhath Puja, Dashera, Deepavali and many more pose a huge challenge in the pandemic control. The report has also mentioned that it has been seen that Onam in Kerala and Ganesh Chaturthi in Maharashtra escalated the pandemic seriously.